I consider myself a miracle child. I was on life support.
Tiffany Frazier's journey with HIV and AIDS began when she was just 18 years old. She was a senior graduating from high school and preparing to go to college.
I was going to Shaw University, and I had to have a physical. And when I went to the local health department to have that done, they did lab work and the whole complete physical. And when I got my results back, they called me and told me I need to come in. And when I came in, they told me that I was HIV positive. I was numb. I didn't really feel anything. I didn't cry. I was like in disbelief.
Tiffany never made it to college. Soon after her diagnosis, she was in the hospital with full-blown AIDS. HIV is human immunodeficiency virus.
It's a virus that once it's in your body, stays in your body. People can't clear it from their system. It infects your immune system and causes destruction of special immune cells called T helper cells, CD4 cells. And as those decline over time, then the immune system becomes incapable of fighting off even the most simple infections. And that's when you develop AIDS, acquired immunodeficiency syndrome. It just indicates a stage of HIV infection where the patient can no longer mount an immune response to even simple infections.
Despite education efforts, Dr. Elizabeth Livingston says many misconceptions persist about HIV, and she says some of her patients are fearful of telling anyone their status.
I think most people who are reluctant to disclose their HIV status to others are afraid of their reaction. Everyone wants to be loved. Everyone wants to be cared for, and they're afraid that they will be removed from the family circle, from the church circle, that they will jeopardize their relationships to others by disclosing their status.
That was true for Tiffany. When she was first diagnosed, she says her mom was uneducated about HIV.
And when I came home from the hospital, my mom started treating me different. She actually started sanitizing everything after I eat, sanitizing the bathroom every time I leave the bathroom. So everything was sanitized, whatever I touched. It was very hurtful. It actually made me feel dirty. It made me feel isolated from the whole family. And I got depressed. I really did.
Eventually, Tiffany says her mom came to better understand HIV, and her family is a great source of love and support. After initial struggles managing her disease, today Tiffany is healthy, married, and active in HIV support groups with her husband Todd. She writes a newsletter and shares her story with the hope that others will learn from it.
Peer pressure and being around my promiscuous friends led me to the life I had. The guy that I was dating at the time, he gave me the virus. At the time, I didn't know he was a drug addict. He was on heavy drugs, heroin and crack cocaine. And we were dating for a short time, for a year, and we had unprotected sex.
Tiffany encourages everyone to practice safe sex. She says even she and her husband, who is also HIV positive, must follow that advice.
I have the same strand as my husband's strand, but at the same time, we still have to wear a condom or practice safe sex, because the other person's strand may interfere with your strand, especially if you're on different kind of medication than the other person.
Tiffany's other advice is to get tested for HIV and to know your partner's sexual history.
I would ask the lady, who wants to be intimate with her new partner, to ask her partner his sexual history, how many partners he's had, has he ever had any STD. I also would ask him if he ever has been tested for HIV and AIDS. If not, I would volunteer to go with him, to get tested before I even consider, being intimate with him. Yes, it's a scary thing to get tested. That's natural. But the important thing is, this is your health. This is, nobody's not going to take care of your health but you. So it's important, if you value your health, do it. Take the test.
I think everyone should be tested. I think it should be part of routine health care. Most of my friends know their cholesterol, but they don't know their HIV status. And I think that it's equally as important
To find out where you can get tested, call your local county health department or visit the National HIV Testing Resources website at www.hivtest.org or call CDC Info at 1-800-232-4636. Dr. Livingston says early detection and treatment is key. While HIV cannot be eliminated from the body, she says with medication, it can become a chronic, manageable disease. Tiffany Frazier is living proof of that. She wears a necklace, "Fear Nothing." They are words she lives by.
For me, fear nothing is whatever I'm faced with, I deal with it head on. Of course, I'm going to feel sad, whatever it may be, especially if it's dealing with my health. But I process it, I educate myself on it, and I move on, because my life doesn't stop. It just keeps going.